Hi everyone, this is Dr. Schroeder with this week's video introduction to week number 3 of our course in the Principles of Staff and Patient Education. And once again, a very nice week of discussion. The focus of discussion this week was primarily on reviewing a variety of the state boards of nursing's Nurse Practice Acts, and specifically what the continuing education requirements are from different states, and to see how different states have their regulatory statuses set up a little bit differently. Their regulatory procedures, I guess I would say. And one of the main topics of conversation that always comes up is that it's interesting how some states do not have any continuing education requirements at all. At least it seems that way when you look at the CEU requirements. States, for example, like Connecticut is one, Arizona is another, and there's a whole list of states that do not have any direct CEU requirements for nurses to receive CEU credits in order to be relicensed. And then other states have probably the most common figure that you see is usually 30 hours over a 2-year period. Sometimes it's 45 hours over 3 years. Sometimes it's 60 hours over 3 years. And also certain states have different categories of continuing education that are required. Some have mandatory training when it comes to mandatory or mandated abuse reporting. Others may have something to do with disaster preparation. But each state is a little bit different. And each state handles their CEUs a little bit differently. The reason, or one of the reasons why you see some states that don't have CEU requirements is not so much because nurses are not expected to get the CEU requirements, is in fact from those states, even those states that do not require continuing education, what is required is currency in nursing and currency in nursing education, and currency in the most effective evidence-based practice. The difference in those states, most of them anyway, that do not have those CEU requirements is that rather than put the onus on the nurse to get those individually, instead it is placed on the healthcare providers that hire the nurses. Certain states, and it tends to be the smaller states and the more rural states, it's quite frankly easier for the state boards that go out and for the state monitoring agencies to go out and do the reviews. It's frankly easier for them to monitor, and they feel that they have a better handle on it if they go and if they look at the education logs in the hospitals and make sure that the nurses that are working are getting their education there. I was at a conference earlier this summer where I met with two educators, and both of these educators were on the East Coast from states that do not have continuing education. And I was discussing how in California we have the 30-hour requirement, and it's something that all of us nurses here, and well, some nurses anyway, in California tend to scramble every 2 years to get those hours in. And these nurses who are both educators are like, wow, they kind of wish that their state went to a system like that, because they were responsible for making sure that their nurses all had between 30 and 40 hours of education every 2 years. And when the state came in, they wanted to look at their books and see that every nurse that was on staff had those hours, or that was prorated. So the onus was on the hospitals directly. And it's not necessarily that one system is necessarily bad and the other's good. As we also discussed in class, there is really good reason why each state is responsible for administering their own state regulations and their own state laws, and that's why the Nurse Practice Acts are all individual to the state. There's no such thing as a National Nurse Practice Act. However, we do have national nursing standards, and we do have national standards as well as community standards for what constitutes appropriate practice. And for the most part, our scopes of nursing are pretty consistent among state lines as well. There are some differences between advanced practice nurses and nurse practitioners and nurse midwives from state to state. But one of the things that I've noticed since I've been an educator now for about the last 18 years is that there's been quite a bit of consolidation between states. There's much more alignment between states on how continuing education is provided, and what the consistent standards are going to be. So it's something that is it's an interesting discussion. We did have an interesting discussion about it this week. One organization that I mentioned in some of the discussion threads that is responsible for seeing that there is some alignment among the states is um, the National Council of the State Boards of Nursing, the NCSBN, and their website is ncsbn.org. They do have some good materials. They're the organization that actually develops and writes and administers the NCLEX exam. So those of you that have been licensed since 1994 anyway, or you all are aware of that organization just because you took the state boards through them. Prior to 1994, the National Council was not necessarily always the state board that was used, but now all states use the same state boards with the same consistent scoring standards, and that hasn't always been true in the past. When I took my state boards in 1986, I was licensed in California and had reciprocity, I believe at the time, reciprocity in 47 states. There were 3 states that I couldn't practice in because their education requirements were different. At the time, it's kind of a moot point now, but I think that Michigan was one of those states. I think Hawaii was another one because they had different scoring standards and they had different standards different from the rest of the country. That's not the case nowadays. And like I say, there's tends to be a fair amount of agreement. Um, in week 3, what we're going to be doing is we're going to shift our conversation towards leadership and talking about different types of leaders and what are some of the important qualities of leadership. How can a person be a leader to a patient, and what are some important concepts to keep in mind, and some of the important models that we use when we talk about nurses as leaders. As I said in week 1, and is a really consistent theme all the way through this class and really through the program, nurse educators are almost by definition leaders in their organizations. An educator is somebody who's directly involved in identifying the needs of the organization. They are involved with leading staff and role modeling and mentoring. And so leadership is an important concept. And so that's going to be the focus of discussion this week. Also, you have your first assignment. You're going to be doing your leadership and case study scenario. And I've had one question in the discussion. They asked the instructor discussion already so far, but essentially what you're going to be doing is you're going to be discussing leadership styles. And the first part of the paper is going to be discussing leadership and some of the important concepts of leadership. Next, you're going to be developing a case study or a scenario where you're going to identify how some education related to a regulatory requirement. Now, the reason that we have it set up this way is because, again, each state is different in the way the regulations are set up. I gave one example or a couple of examples in the Ask Your Instructor discussion, but I'll give you another example. One example is I'm a mental health nurse, and part of mental health nurse's responsibility is to identify patients and to understand the rules and regulations when it comes to involuntary hospitalizations. All 50 states have some form of a involuntary commitment process where patients are admitted to the hospital, typically, although not always, for 72 hours, and then with a follow-up period of time after that with varying degrees of due process that is provided through the legal system. So every states have the same basic legal framework. However, it is very state specific. What we do in California is we have what are called 5150 laws. It's Welfare and Institutions Code 5150. It's state laws that explain very explicitly how the 72-hour and how a 14-day hold and how conservatorships are administered. And it specifically states what the role of the registered nurse and psychiatric technician and social worker and doctor is in that process and who administers it. In Arizona, where I've also practiced and still practice occasionally, especially in the summers, we have called it Title 36 there. Title 36 is similar, but actually much different. The role of the nurse is different there. The role of how patients are informed. So even though you have consistent standards and consistent laws, they're administered differently from state to state. So that's why there's this focus on the regulatory. So identify some regulatory aspect that requires education. Think of your own practice, some things that you know that you have to be, aware of. Mandated reporting, HIPAA laws, EMTALA laws, all of these things are examples, and there's many more than that. But identify a scenario where you would use to teach, and what are some of the objectives that you would have for that particular scenario, and then discuss how you would use leadership, or how leadership would be involved in administering or in monitoring the effectiveness of that educational outcome. It's all pretty well spelled out in the syllabus and in the rubric. Please follow the rubrics. I follow rubrics pretty closely. And so if you are able to look at the rubric and you address the points in the rubric, you should do pretty well. And so as you have any questions, of course, this week, please feel free to go ahead and post those. Those will be due next Sunday. I'm recording this on Sunday, November the 5th, so they're going to be due the following Sunday after that. They're always due by that 11:59 on Sunday evening. Written assignments are due on Sunday. Yeah, final discussion responses are always due by Saturday, so but realize that you have until Sunday to get those papers done. So once again, I look forward to participating along with you in the discussions. We've had some excellent discussions, some great points brought up, and I look forward to seeing you in the discussions and seeing you in class.